Hey, good afternoon, everybody. Welcome to the workshop. I think we'll go ahead and get started. I see quite a few people have joined already. Chris, I'll turn it over to you to kick us off.
Hi, good afternoon, everybody. Thank you for joining. You are here at the Prescription Programs webinar, where we're hopefully going to provide some additional information for you all to learn about, regardless of where you're at, whether this is the first time you've heard of this term, whether you are well acquainted and you're wanting to learn more, or maybe you're in the middle of one, you want to kind of troubleshoot. Hopefully, in this kind of format, we can kind of meet you where you are, provide you some additional information, and we've got a great hour plus plan for you all. Let's get going. So first of all, the goal for this project, this hour or so, we're gonna first talk a bit about what these produce prescription programs are, why they exist, what gap are they here to fill, and what they try to do. We have some great speakers that will be joining us a little bit later, providing their perspectives. Getting their perspectives from a local, whether as a participant in one of these programs or as a funder of these types of programs, getting kind of a low on the ground perspective and a high level perspective. We have a tremendous resource on the call to talk a bit about the national perspective, what different models exist, what are some best practices that are out there. And then I'll be able to kind of talk a bit about towards the end of the event around what are some strategies you can take forward to expand here, both at a medical practice and within the community, what attributes you need to think about as you proceed with this potential program. So that's the plan. We'll try to do our best with it. Next slide. So who we are, Linnea, do you want to kind of quickly give sort of an overview of this project? And then I can introduce myself and introduce Kim.
Sure. Yeah, so my name's Linnea Webb. I work at the Marian Swetland Center for Environmental Health at Case Western Reserve University. And we are partnering with the Cuyahoga County Board of Health here in Cleveland that received a grant from the Centers for Disease Control and Prevention called the REACH grant, which stands for Racial and Ethnic Approaches to Community Health. And the Swetland Center is specifically working on the fruit and vegetable or the nutrition strategy focused on expanding access to fruit and vegetable voucher incentive programs, which are offered at farmers markets and local grocery stores and other locations, and then produce prescription programs. So that's really our focus for today. So these are all of our partners on the REACH project this year, working with Catalytic Change Link on the fellowship piece, Better Health Partnership, which is Chris, who's here today, and then Kim Hines, who's also here today from the North American Food Systems Network.
Great. Yeah. And as Linnea mentioned, my name is Chris Mundorf. I work for Better Health Partnership, which is a regional health improvement collaborative here in Northeast Ohio, serving as its chief strategy officer. And Kim, maybe you want to introduce yourself because you'll be coming in a little bit later.
Sure. My name is Kim Hines. I'm the co-director of the North American Food Systems Network. I'm based out of Washington, D.C., and our organization is a professional association for community food systems folks. So if you're that, welcome. I also have experience in a fruit and vegetable prescription program that goes back about a decade. So we'll be talking about that later.
Great. Yeah, and the goal of this hour plus is, we're going to provide some facts, some experiences, and we have a lot of opportunities for, I guess we can call it questions and answers. I prefer questions and response because I will respond to your question. It may not be the answer you're hoping for. And I think a lot of this, especially in this ever-evolving environment, we can give you our perspectives of what we've seen, and you're going to have to kind of sort out sort of the what works best for you, because it's a very fluid environment. So, but we'll have a lot of opportunity to hopefully interact as this webinar progresses. But I believe next slide. And I think Kim, you can take over in the introduction.
Sure. I remember when I first heard about produce prescription programs, it was about 11, 12 years ago. And I had the executive director of Wholesome Wave, Georgia, at my house. We were just sitting there talking, and she was telling me about this idea, this innovation. And immediately I was like, that's beautiful. And how can I get involved? And I think a lot of people are drawn to the same, right? Because it just makes a lot of sense. So produce prescription programs increase the requirements to screen for social drivers of health, right? And they also grow incentives to address those needs in several ways. One of the ways they do that is to give back to the community, to further engage patients in their own care, to improve health outcomes using food as medicine, to increase cross-agency collaboration. And that's a really big part of what a produce prescription program does, as well as strengthening local food economies, which is my favorite part of a produce prescription program. With all of those elements together make up a program that innovatively, collaboratively, and I think respectfully address food insecurity in a healthcare setting. Next slide, please. Produce prescription programs come in many flavors. I've seen so many different approaches to produce prescription program, but they typically all have three things in common. They all they all involve a prescription of some sort written by a healthcare professional based on the health needs of the individual participants involved in the program. They all involve access. They involve access to healthy foods, oftentimes to people who lack that access to fresh fruits and vegetables. And they all, of course, involve consumption of those fresh foods, oftentimes coupled with education, such as cooking classes or sometimes family cooking classes, and a wide variety of educational programming that can come with consumption. Next slide, please. So research has shown very favorable effects of produce prescription programs. And as you can see here, for example, the University of Massachusetts showed a reduction in A1C levels among diabetic patients, for example. The American Heart Association pointed to the fact that programs such as these help to reduce food insecurity. And Tufts University in Boston showed that that programs such as these can help address cardiovascular disease and save communities money. So if health wasn't enough, perhaps saving money and the promise of saving money in the healthcare system will get us all to that place where we're moving in the direction of adopting more and more of these programs in our communities. Next slide, please. You have local existing produce prescription programs in your county already. You have 4 of them. The Neighborhood Family Practice Community Health Center has a program called Food as Medicine Program. University Hospitals has a program called Food for Life Market. Metro Health has a program called Food as Medicine Program. And the Cleveland Clinic has the Thrive Diabetes Program. Even more exciting, you have 4 more programs emerging within your community. And actually, to be more technically correct, you have 3 more emerging in your community, and then 1 that is evolving. So the root of it all, Breaking Every Food Chain and Flourish RX, are new emerging programs that are looking for your support, as well as collaborators. Metro Health's program is adding an additional layer to their programming called Taste of Home. And Taste of Home is a project that further advances the possibility of developing local food economies within your county by expanding the life of fruits and vegetables that are being grown right now in season, and using food preservation to keep them available for longer. The reason that you have new and evolving programs coming in your community is because of these 8 fellows. The REACH fellows worked in teams of 2 to conceptualize and plan new prescription programs, produce prescription programs throughout the Cleveland area. So at this time, it's really important not only to recognize these innovators, but also to think about what it is that they are looking for, that they have asked for support in being able to get those off the ground and evolved. And here's what they've asked for. They have asked for funding for implementation and program costs, including food costs. Food costs are a part of the program that are often hard to cover. They're looking for collective funding opportunities. In other words, collaborators that would also benefit from working with them together and finding funding together. They're looking for food processing equipment and facilities to do that in, and food storage space. It's a big one. Incentives to integrate culturally relevant local food into their programs is a big part of their asks, as well as grant writing support. They are looking for healthcare institutions support to implement pilot programs and volunteers to help with those programs. They're looking for translation of program materials into different languages, cooking tools for their participants, strategic planning support, trained personnel, and transportation support for their participants. So if you're in this webinar today and you can provide or are interested in providing any of these elements, here's how you would reach out to offer that support. Just email reach@case.edu. So who's involved? What are the roles of a produce prescription program? What does collaboration look like? And what has been learned from working together? Today, we're going to hear from 2 speakers who will speak on from their perspective on these roles. Typically, the roles in produce prescription programs involve, of course, the participants, some programs called patients. It involves clinicians, the people who actually do the work of writing up the prescription and connecting it to the healthcare needs of the participants. It involves funders, of course, funders who are able to support the costs of these programs. And ideally, it also involves local farmers, people who are growing from and benefiting from keeping food money circulating locally. It also involves those volunteers, it involves civic organizations, it involves as many collaborators often that you can pull together. Sometimes collaborators look like people who are offering commercial kitchen areas for cooking classes. Sometimes collaborators are civic organizations that can get help with fundraising and getting the word out. Sometimes collaboration looks like space, right? The storage space, or that space in which other parts of the program can occur. I am going to now turn it over to Chris, where he will introduce the speakers so that we can get more into the nitty-gritty of what these roles look like.
Yeah, thanks, Kim. Yeah, it's my privilege that we have 2 tremendous speakers that are here today, and I'll kind of introduce each one. I guess I'll introduce both, and then kind of we can start with Leora. But first, we have Leora Porter. So she was a participant of one of these programs, and again was going to have tremendous perspectives on what that was like and her experiences. And then at a at a higher level, we have Shelby Kammerer. She is a participant in as a funder of these different projects. So I think she'll have a very unique perspective around that. But first, Lior, I see that you're on. Would like to welcome you. Thank you for coming, and we're so excited to hear from your experiences.
I'm gonna see if I can make Leora a co-host.
Okay.
So I think because it's the webinar. So bear with us just a minute.
Bear with us. All right. Welcome, Leora. We're so excited to have you. And if you're able, yeah, you can kind of go ahead. We'd love to hear from you. Leora, can you hear? You're unmuted. Can you try to, are you able to speak? There you go.
I am. I'm sorry. I wanted to blur out my background, but sorry. Okay. Can you guys hear me well? Okay, great. Hi, I'm Leora. um, is it? I can my speech now or? Okay. Again, hi. Hello, everyone. My name is Leora Porter, and today I'm not just speaking as a professional or a committee member. I'm speaking as someone who once was on the other side of this program as a participant. I was diagnosed with prediabetes during one of the most emotional draining seasons of my life. Physically, I was present at my doctor's appointment, but mentally and emotionally, I was drowning in we went with another candidate emails. I couldn't process all the health information being thrown at me because all I could think about was how am I going to land a job to make ends meet. And then in walks this lovely nurse named Sue, tiny in frame, but big with a big, beautiful spirit. And she gently said to me, I really think you'll be great for this program. She didn't say it like it was just another checklist. She said it like she saw me. That moment planted a seed. From there, I enrolled in the produce prescription program. And I'll be honest, at first I didn't expect much, but week by week I started noticing changes. That consistent brain fog that I was used to living with started to lift. I wasn't just getting food, I was getting energy. I was getting flavor back into my meals. I was getting me back. I built real relationships with the farmers at the West Side Market. They know me now. And I'm sure some of them brace themselves when they see me coming because I have a lot of questions. But those interactions reminded me of the joy that still exists in everyday moments. And let me tell you, roasted artichokes, life changing. I started experimenting with thyme, parsley, cilantro, fresh, vibrant ingredients that made me excited to cook and take care of myself again. This program reminded me that I don't have to exist. I can be a participant in my own healing. And the best part, I am proud to say I am no longer pre-diabetic. This program didn't just give me produce, it gave me power. It gave me ownership over my health. It helped me create new habits, new joy, and a sense of hope. Since then, I've gone on to serve on patient advisory boards, become more involved in my community, and advocate for others like me. People who just need one person to see them and say, I think you'll be great for this. So I stand here today as living proof that programs like this matter, not just in theory, but in practice, in kitchens, in blood sugar levels, and confidence. Thank you to everyone who makes produce prescription possible, from the medical professionals to the market vendors to the people behind the scenes. You are not just handing out produce, you're planting hope, and I'm so grateful to be one of the people who got to grow from it. Thank you.
That was wonderful. Thank you so much, Leora.
Thank
I think
you.
that was very inspirational, and it's great to hear that as a reminder of what the impact this can have. Um, I want to remind everyone that if anyone has any questions, we can kind of pause right now. If anyone has any questions for Leora, you can put them in the chat, and if not, we can kind of talk to Shelby, or even we can have opportunities for questions and response later in this hour. But just want to give an opportunity if anyone has immediate questions. Oh, good. Kim has a question. It's Kim's question to Leora. Leora, are you active in recruiting others to these types of programs right now?
I'm not like, well, yeah, I'm always raving about the program. I'm also working with Better Health with a diabetes research. And so I've been telling a lot of the participants there. So yes, I'm constantly talking about the program um, on my own.
That's great. Thank you. Thanks for that question, Kim.
It's a really great program, and I'm so grateful. It's life changing, and again, I can't express that. I didn't realize that just eating fresh vegetables, honestly, it was like a luxury, because when you grow up in a area where you don't have that access, like artichokes. I never even knew what that was, and they're one of my favorites.
That's great. All right. Well, thanks again, Leo. And
Thank you.
we want to open this opportunity that will, if you think of a question, we'll have an opportunity to kind of pose some more questions to Leo later on. But thank you again. So again, it's my privilege to introduce our next speaker. Shelby Kammerer represents sort of a funder's perspective of this sort of project. And we thought it would be nice to pair Shelby with Leora to kind of get two sides of the perspective of from her vantage point of the value of this type of program and her experience with this. And I believe you have some slides too, right?
I do.
Great,
I've got them pulled up and I'm happy to share, or Kim, you can, whichever is easier for you.
Yeah, we can share them for you, Shelby. Just let me know when you need me to move on.
I'm ready and got my notes with me. So
Great,
keep
thanks.
looking up. I'm just looking at my notes.
Okay. Here.
While Linnea getting that pulled up, I just wanted to say thanks to everyone for being here and for giving me the privilege of being able to speak in front of you today. So as Chris said, I'm Shelby Kammerer. I'm a program officer at Mount Sinai Health Foundation. We can go to the next slide. I wanted to give you a little bit of background on who I am so you know where I'm coming from. So in my career, my first job was as a grants and evaluation manager at a SNAP Ed implementing organization. So an organization paid under a federal contract to implement exercise and nutrition focused services in Austin, Texas. 4 years ago, I moved from Texas to Cleveland. I did have to buy a coat. Thank you for asking. And I became the director of health at United Way. At United Way, a lot of my focus was on food there as well. I managed the contract between the county, the food bank, and Hunger Network, where we were able to fund food pantries locally for general emergency food. And then also the Emergency Food and Shelter Program, another federal program that provides dollars for food in local communities. And then for the last year and a half, I've served as a program officer at Mount Sinai Health Foundation, where our approach to food would really be thinking about food as a means of access to healthcare. So if you think about all of the different social determinants of health, having a good job, having education, having good housing, there's a lot of those things that we could work on. Our focus is access to care. And so things like produce prescriptions, medically tailored meals, those are all areas that Mount Sinai can and has funded. And I should mention at United Way, I also was able to do some medically tailored meal programming there. From another perspective, I just wanted to point out that I was also a member of the Advisory Council of Nourishing Power Network. So I'm just really pleased to see some familiar faces today. And we can go to the next slide. I wanted to give a little bit of background on how funding works in general for anyone who isn't familiar. So for this slide, I really just wanted to talk about different kinds of funding that are available for programs like produce prescriptions and others. My background, again, is in foundations. That's where I work now. So we'll spend the most amount of time talking about foundations, but I just wanted to point out some other ways that there can be funding for work like this. When you think about individual giving, that is when you're just having individual people who are interested in the program that you do, who are supporting it. If you've ever gotten a message from the American Red Cross saying, really, we would love $10 or a couple gallons of your blood, that sort of individual giving. There's corporate giving too, where you can work with organizations that are for profits that just want to use you to further their mission in the community and also put their name out there. So when you see something that's sponsored by Key Bank, that's an example of corporate giving. They're not a nonprofit, but they care about their community and it helps them to have their name on something. Government funding is something that we would typically think of as the most sustainable. They'll pay for your operating dollars. They have bigger budgets. We know that right now government funding is a little bit wonky. Under the current administration, we're all familiar that government contracts have been paused, cut, canceled, including SNAP Ed, which is my first job in sort of produce prescription related work. That doesn't exist anymore. But there's still lots of opportunity for government funding, and this is something I have a little experience with, so happy to answer questions about it that won't be the focus of what I talk about today. You can host events to raise money, you can charge fees for service, but really I want to talk about how foundations, especially local Cleveland area, Cuyahoga County foundations, might be able to support your work. So we can go to the next slide. So I wanted to talk about local philanthropy in terms of a few things that you can do to have the most strong approach when you're thinking about getting a project in produce prescription or otherwise funded. The first and most important thing that I can say is that doing your research is so critical here. It's hard to hear, but the truth is that every foundation operates very differently. We have a lot in common. Most of us are colleagues and talk to each other. So I have colleagues at Cleveland Foundation and Gund Foundation and St. Luke's Foundation and Neighborhood Connections. We know what each other are doing, but that doesn't mean that we do things the same. So it's important if you're thinking about approaching a foundation for funding that you understand things like, what are they interested in funding? When are their deadlines? Do they have strong deadlines? For example, Mount Sinai has 4 deadlines a year. So we have 4 opportunities throughout the year to do funding with us, the first of the month every 3 months, essentially. But it would be important for you to be building relationships with us in between, because sometimes there are opportunities for us to make discretionary grants outside of those 4. But that's just what Mount Sinai does. Others might have more or less grant cycles. They may be invitation only, where you don't even get to apply if you're not invited to apply, or they might have multiple steps. So they might say, we want you to put in a letter of interest before you're invited to write a full proposal. So it's important for you to understand when you're making those approaches, how those foundations work. You also need to understand the limitations of how foundations function. And that is really in 2 different ways. One is in what are the actual priorities of the things that they are interested in funding. So for example, at Mount Sinai Health Foundation, we fund in 4 different areas, 2 of which could be relevant to produce prescriptions, which are in equitable health outcomes, funding programs that help to close health disparities, specifically through things that we would consider access to care. But we also fund in health policy. So if you are working on a policy related to produce prescriptions, like getting more Medicaid coverage for produce prescriptions, for example, that might also be a place where you could approach Mount Sinai. But there are others that won't do those things or do other things. St. Luke's Foundation is a local foundation that operates on the east side of Cleveland, and most of their work is very specific to a few neighborhoods. So they're less interested in funding things that benefit the entire state of Ohio and are really more focused on a grassroots effort and funding more smaller organizations. They also do more year-over-year operating support, whereas my organization is typically more interested in funding a program or an evaluation, something more discrete that could fit into a year or two of funding, rather than funding kind of continuous support for staff year over year. Another thing you need to think about in terms of the limitations of foundations is how much money they really are giving away, so that you can kind of frame your ask appropriately. It's important to put into context, I think, because we can think of foundations as places that have limitless dollars, and certainly there are a lot of resources available within foundations that we can and do deploy in communities. But just as an example, my organization, Mount Sinai, gives away about $8 million a year, which is a big number. But our Health and Human Services levy for Cuyahoga County is closer to $250 million a year. So you can kind of see in comparison that 8 million would never be able to replace the funding that the government provides for programs. So you might hear foundations like mine and others suggesting that as you're building out new programs, you need to find ways to be sustainable. It can sometimes be a challenging thing to hear because you think, what will make me sustainable is your money. But 8 million a year, if I picked 8 organizations and gave them $1 million year over year, how much difference is that making community-wide versus trying to make investments that can help folks, help organizations get connected to something like government funding? So as an example, we have paid to bring on a community health worker for the first 6 months while that community health worker is building up their expertise and ability to bill payers so that they can get reimbursed for their work in a mechanism that's more sustainable. So all of those things are things that you can understand by doing your research, but I'll actually flip over to my third column here and talk about building relationships, because that's also where you can get a lot of this information. A lot is on the internet. We have a website. You can see our deadlines, our funding priorities, but some of that nuance can get a little bit lost when you're just reading something online. So I also think it's crucial to tell you that most of us that are program officers or staff of foundations are eager to talk to you. Our jobs are to hear from organizations and people in the community about where needs lie. Now, again, every foundation is different. Some may be busier than others, but I can at least speak from my perspective that I've never said no to a conversation with someone who wanted to talk to me about where Mount Sinai might be able to provide some partnership or funding, even if I think that there's not a very good road to success between that project and my board's willingness to fund it. I always take those calls because it's an opportunity for me to be proven wrong. Sometimes it's a great fit and I just didn't understand it, but also sometimes we can help you make connections. So if you're talking to someone who works in philanthropy, ask them about the work that they do, the work that they fund, and then also if they have other connections that they can make for you. Sometimes those connections are to funders who are a better fit. So for example, Mount Sinai really doesn't do much work, if any, in environmental health. We know that it's important. We know that it's a part of health. We know that there are disparities in environmental health. But if we tried to fund everything where there were disparities, we'd be really, really broad. So we really focus on access to care. But if someone came to me and said, my focus is on rejuvenating parks in the community, can I talk with you about funding at Mount Sinai? I would tell them straight up, it's unlikely that we'd be able to support a project that funds parks, but I'm happy to have a conversation with you. And then I would probably tell them the 4 people I know who do funding at Gund Foundation or Cleveland Foundation or St. Luke's who do fund in environmental health. So even if you don't get funding from a foundation, you can get resources. They being foundations or staff of foundations, may be able to point you towards other resources. So for example, perhaps you have people that work with you that go out in the community and talk to people about their health, but you might not know that those people could be registered or certified as community health workers. And then there is some possibility for reimbursement. So Staff at foundations can be useful to other organizations that are trying to implement programming by just talking through some possibilities, trying to be a thought partner. So that'll move me into my sort of middle column here, which is how you stay connected with foundations. First of all, don't be afraid to do cold outreach. Now for us, it will be a warm outreach. So if you want to talk to me, I'm sure that the staff here can share my information, or I can put it in the chat. I'm happy to have one-on-one conversations with anyone who is interested from a Mount Sinai perspective, or just going a little deeper with someone in philanthropy, even if we're not a good fit for what you're doing. But most organizations, most foundations have staff like me. They're mostly called program officers, but sometimes different places use different terms, and they'd be happy to talk with you as well. So don't be afraid to do some cold outreach to those people. But if you have any opportunity to get a warm handoff, for example, if you talk to me and I think that you'd be a good fit for someone at the Woodruff Foundation, then I can send the email connecting you so that there's more likelihood that you end up at the top of someone's inbox. I would also recommend that you try to follow newsletters from different foundations that you think kind of match your priorities, so you can stay up to date with if they're changing the way that they fund, when their deadlines are, and if they are hosting any kinds of events, annual meetings, things like that, where you can kind of get together and rub shoulders with people in those sectors. One last thing I'll mention as far as getting connected is, if you're not already, think about joining or at least exploring access to the Cuyahoga County Human Services Chamber. This is essentially the same thing as like a business chamber that you think of in a community that represents the needs of the human services sector in our county. It's housed under the Center for Community Solutions, and they are going to be doing, they just launched end of last year, beginning of this year, but they'll be doing tons of educational opportunities, networking opportunities for folks who work in human services, which produce prescriptions absolutely would fit into, to learn together about policy, about grant funding, about really anything that you can think of, especially in these really challenging times when policy may not feel like it's working for us and funding can feel a little scary. The chamber is going to be a place where people can find some connection. So all of that to say, produce prescriptions could be a good fit for Mount Sinai. So if you're interested in talking to me specifically about that, I'm happy to talk individually, but I'm also happy to take questions about sort of how foundations work, how philanthropy works in general. And I will go ahead and leave it there. Thank you all so much.
That was wonderful. Thank you, Shelby. That surpassed my highest expectations. I really appreciate it. Yeah, immediate thoughts or questions from people, feel free to put in the chat. But as I mentioned with Leora, we can also continue these question responses as the hour progresses. But again, thank you both, Leora and Shelby. That was amazing.
Thank you all.
Thank you.
All right. Well, again, feel free to hop in the chat and we can always kind of reconvene these folks. All right, so we can continue proceeding with the deck.
Great. I want to provide a national overview about several model programs that I'm aware of and or have worked with, because I think that having a bigger vision, a more comprehensive vision for prescription programs for a whole city or a whole region can help, right? So today what I want to talk with you about are kind of three approaches that different areas have taken to their produce prescription programs. I want to talk with you about Wholesome Wave, Georgia, and obviously out of Georgia. We'll be talking today about COPE, and that is located in New Mexico, Utah, and Arizona. And then I want to talk a little bit about the Blue Ridge Area Food Bank and their food pharmacy program in Virginia. So let me just have you go to the next page. And we're going to talk about Wholesome Wave, Georgia first. Yeah. All right. I'm going to back up a little bit and tell you the story of an organization that I used to be the executive director of, partnering with Wholesome Wave Georgia to stand up the first fruit and vegetable prescription program in the state of Georgia. It was that same woman that was at my house, the executive director of Wholesome Wave Georgia, in about 2015. And the story goes that she was explaining this model that Wholesome Wave, the national organization, had just kind of been getting off the ground. And she explained that Wholesome Wave Georgia was setting itself up as a statewide organization to do what Wholesome Wave National was doing for Georgia. Well, what was Wholesome Wave Georgia going to do for Georgia? Wholesome Wave was going to centralize fundraising for fruit and vegetable prescription programs throughout the state of Georgia. They were going to take primary responsibility for the research involved in these programs, but they would do it collaboratively with the different communities that they were working with. They were going to gather peers doing these programs in different locations through the state so that the peers could learn from each other, the practitioners on the ground running these programs, and they would take care of the statewide impact statistics, right? So that they could tell the story, tell the narrative of what produce prescription programs were doing for the state of Georgia in general. I said, sign me up, right? Sign me up. But what was really compelling to me, besides the fact that they were going to take primary responsibility for fundraising for these programs, what I really loved was that each of the individual sites was going to have autonomy over their own programs, right? They wanted to start with different farmers markets throughout Georgia. So they started with ours because I begged and pleaded to ask them to start with us in Augusta, Georgia. Our responsibility was to find a clinical partner in the community in which we would be working. Our responsibility was to imagine and then plan and then implement the educational programming to go with our prescription program. And then we were also responsible for any secondary research that we might want to layer on top of their primary research. So in our case, we were interested in mental health research, quality of life, and outcome studies, and they were doing biometric research. So together, we ended up with some very, very good data showing not just that the biometric outcomes of the program, of the annual program, but also, different elements of, did people's quality of life improve, right? Sometimes then it doesn't matter if a number changes. What matters is if someone reports that they're going out more, for example, or better able to take care of things at home. So that's what we were measuring. We signed on, and I remember so clearly, like literally sitting on the floor of an office in Atlanta at one point. We were actually writing on scraps of papers, like all of these ideas that we were coming up with. Collectively, we were in Augusta, but we brought folks from Augusta. We brought a couple of clinicians. We brought some volunteer RDs who were just very engaged and wanting to hear more. We brought a couple of potential participants so that they could lend voice to the plans that we had bubbling up. We brought with us a local researcher, so that local researcher could talk with the primary researcher. And we brought farmer market managers because if you do these produce prescription programs with farmers markets, there's a lot of moving pieces to programs like this. And we sat and we talked, and we took about a year to develop the program together with Wholesome Wave Georgia. What did Wholesome Wave Georgia do? They fundraised. They fundraised to cover the costs of the food, and they fundraised to cover the cost of our market manager that helped implement the program. we, on our side, we fundraised and found volunteers to cover the cost of our educational programs. And the clinic, although I have to say that the clinic we got very lucky in that the clinic came on as an in-kind donation to the project. So the reason that I want to bring your attention to Wholesome Wave Georgia and the incredible success that they continue to have now a decade later is that they have taken a large chunk of the responsibility from these programs on for themselves, right? Onto themselves. They host big, beautiful fundraisers, and they're in constant fundraising mode and fund development mode with decision makers like Shelby. Shelby, you're not in Georgia, but you get what I mean. To help those funders and those potential funding collaborators understand what it costs to run these programs and what the potential benefit to them is as a result of the impact stats that they are able to collect. Because I come from agriculture, I was also very, very interested in the impact on farmers, local farmers who are selling food and receiving additional revenue as a result of being involved in these programs. And that was incredibly successful. It wasn't just financially successful, and it continues to be financially successful. I don't work in Augusta anymore, but I want you to know that these programs continue there in Augusta and throughout Georgia. It was so successful because of the relationships that farmers created with program participants, and that program participants created with each other, and that clinicians created with farmers, and that farmers created with education program folks. And sometimes farmers were the education program folks, and sometimes past participants were the education folks. That was the beauty of it, right? We can mix it up. We can mix up those roles and value and understand all of the things that all of the people in these programs bring to the table. The other thing that I want to say is that as far as Wholesome Wave Georgia is concerned, is that being able then to gather annually with peers doing these programs all over the state, people that I didn't know at first, and people that, they're running their own programs designed by them. But to be able to come together once a year and hear how different groups were doing their programs, learn from each other, challenge each other to address, right, the gaps that we continued to identify or the challenges that we continue to identify, that was extraordinarily important. We brought several representatives from our community every year to that annual peer gathering, including a couple of participants, as well as a couple of clinicians, a couple of educators, and a couple of farmers. It was one of my favorite times of year, if you can't tell, because it can be lonely, isolating work. You're probably the only person running a fruit and vegetable prescription program in the community in which you work on a regular basis. And so to be able to join with others doing the same, struggling with the same things was valuable. For the next slide, thanks, Lena. I want to talk with you about CORE. I have not been directly involved with CORE, which is located in New Mexico, Utah, and Arizona, and working with Navajo Nation there. But I have been following them for quite a while. And what I really love about their focus is that it is on the retail partnerships. If you were just to look up CORE, you're going to see that CORE is very invested in making sure that not only the participants in their monthly prescription programs benefit from these programs, but also that those local retailers selling locally grown food throughout the Navajo Nation also benefit. So their focus is on that circular economy, and also on business economic development. On my vehicle, I have a truck that says no farms, no food. But really, ideally, what it should say is no farms, no retailer of local food, no food, right? Because because we have to really embrace local retailers who are selling and making foods available, local foods available to people in order to increase access. I really encourage you to just go look up and see the 22 local retail stores that are listed as their program participants. My understanding is that program participants receive like token currency to be able to purchase from these retail outlets, and then those retail outlets are reimbursed. Very similar to the way that we ran ours at the farmers markets. But I have also seen, not at core, but I have also seen programs, produce prescription programs in which retail outlets were selling the food, but at a subsidized cost, so that it was an affordable option for people involved in these prescription programs, subsidized with fundraising or with tax funding. But that you saw a little bit of that sustainable model that Shelby was talking about built right into there. Yeah. And I'm with you, Shelby. Like seeing SNAP Ed being cut is it's heartbreaking, because SNAP Ed was often built into programs such as that. The third program that I want to talk about is and I really like this approach because it's all about baby steps first, right? So where food pantries stand up and how they might stand up prescription programs. Oftentimes, food banks are working with many pantries. In this case, in the Blue Ridge area of Virginia, they're working with 122 pantries, right? And they needed to kind of create that culture of healthy pantry initiative of we distribute healthy fresh foods before they could take on a prescription program. Yeah. So they started with a pledge, which they call their HPI, right? They signed on to their HPI. 59% of those pantries have signed this pledge. The pledge is that we will provide a certain percentage of the food that we provide. We'll do everything in our power to make sure that it meets certain qualifications for fresh food, fresh fruits and vegetables. I don't know how long it took them to get to 59%. It's a pretty good number. And I read on their website that looks like they continue to, to encourage other pantries to do that. But that is a baby step. It's a cultural, mind shift that then led to their being able to then work with some of those pantries that were already bought in, right, to the HPI, to then establish clinics at those pantries in which evidence-based nutrition guidelines could be used to run the prescription programs. I tried to find they actually developed a platform, I guess, for tracking the nutrition for I'm going to say this right, but for tracking the nutritional benefits that the clients in these prescription programs were, receiving. I tried to find a link to that Nourish platform, but I couldn't find it. I was really hoping to see it inside of it. But it makes sense, right? It makes sense to use a platform to start tracking the nutritional density of foods being distributed by food banks and food pantries. And the best way to do that might be through a prescription program. So that's my three. Those are the three I bring to you. And those are three that, are worthwhile looking at, because not only are they doing it in one county, but they're doing it in a region, right? And in a Wholesome Wave, Georgia's case, in a whole state. And so when you're able to kind of expand and take on responsibilities of these, what tend to be prescription programs tend to be quite small in the actual implementation of them. They have to be, right? They have to be hyper local and hyper focused on the participants, so that participants, have benefit from that close-knit community in which they're participating. But taking some of those bigger, more overwhelming elements off of their plates, like the fundraising, like the large scale research and outcomes tracking, may benefit a place like Greater Cleveland. Thank you.
Thanks, Kim. Any questions for Kim? That was an amazingly great overview of these national models. I'm gonna pause just if you have any questions, but again, we'll always have opportunities at the end.
Oh, Casey, I know Sarah was, yes, Sarah was one of the people at Wholesome Wave Georgia with whom we worked to establish our program in Augusta. I'm so glad that you know her. Yeah.
Any other personal connections or questions? All right, thanks again, Kim. That was great. Next slide. Great. So what I appreciate about this program is it's always a little bit more complex than I'm willing to give it credit for. It is inherently multi-stakeholder, and any kind of multi-stakeholder program, you need different perspectives. So I appreciate hearing Kim's perspective, which is very different than my perspective, and we're both right in different ways. And you need and I think something that Shelby mentioned earlier, that I think if my main thesis that I want to get across is that this is inherently relational. That if you are doing this in a silo, you are doing this wrong. That I will be hesitant to say that very often, but you need to do this in a community of people, and you need to do this iteratively and through conversations and learning. And I think the lens I'm going to have I come from the world of clinical QI, and I think a piece of this that is essential is that you need a clinical champion. And it doesn't mean that you are a martyr or you're the person that's sort of having to do it all, but you do need someone at the clinic who can really kind of take this on and sort of move this forward. And I'm going to offer some principles that I've seen work at other sites. Again, it's not a rule. By all means, prove me wrong. Come back to me that you were able to launch this without following these principles. And there's definitely some easy outs here where I think there are practices that have been able to launch, medical practices that have been able to launch this by getting a very large grant or a very large donation. And God bless you if that's what you received, and that's great. Oftentimes, how other practices have advanced this is either through braided or blended funding. And I think it requires you to really view this, you got to nerd out and really view this in little pieces and chunks. And again, some principles that I've learned is that I would really recommend you sit down, no matter how small your practice is, whether you're an FQHC or a large system, you have either a development person or a value-based care coordinator. I'd recommend you buy that person a cup of coffee or a beer, depending on the time of the day, and you sit down and you talk to them about what are the existing incentives and opportunities that exist in your practice. And you're going to be amazed at what all the levers and incentives that exist. Again, with value-based care, there's a shift away from fee for service where insurance is reimbursing people for certain opportunities, instead giving practices rewards for hitting outcomes. And as Kim mentioned in one of the earliest slides, this is a proven outcome that this leads to proven improvements in health. And I think oftentimes how we want to get there, there is a route to sustainability. But in this situation, from a medical practice, you're thinking about tests of small change and PDSA cycles. And oftentimes the bridge the gap from sort of a step 3, which is your value-based care reimbursements, to a step 1 is in that small scale philanthropy. So I think Kim and Shelby all mentioned this, that I think it's really key to work with your developmental officer hand in hand. And I think every situation that has succeeded in this region it grew out of small scale philanthropy giving. So I think really working hand in hand, people like to fund these types of projects. But so getting a sense of what's out there. And oftentimes, I at least 2 situations I can think of, they were surprised to find that there was funding that was available that they didn't know. So that's step 1. Step two, again, this is the nerdy element, but again, this is fun for me, but I'm recognizing that I'm not normal in this element. So you really want to map out your plan. Think about who's doing what, and what are we actually talking about. So this gets into your relational aspects. So you need to think about your plan not just from the medical practice perspective, but who are you working with out in the community? Who are you interacting with? And again, start to kind of, as I've done this, put a little post-it notes of where you think you have coverage. So where you maybe have some FTE supporting a grant through a grant of certain nurses' time, or maybe there's some leftover funds for funding for foods, or maybe there's a small scale pot of funds for value-based care related to those elements. But you'll be surprised that there's going to be at least, we're probably talking about 15 steps in this process, but there's going to be parts of this process that you're going to be surprised that are going to be covered. And again, this is where you really want to bring in different people. And at the very least, you're meeting friends, making friends, which I think this is what is the good process in all of this. Then then as you're mapping out your process, I want you to really kind of think about where there's sort of grounds for incentives. And this is where I think it's helpful to be squishy in what the direction of this project can do based off of where there might be impact and where there might be feasibility. So we have a lot of evidence in among some populations and some health outcomes. Kim mentioned A1C, obviously chronic disease, but really thinking like off the top of my head, I could think of 3 elements that you might want to be squishy about of how you might want to direct it based off of the funding and the what I would call tailwinds. So populations, are we working with pregnant individuals? Are we working with kids? Are we working with the elderly? Really kind of thinking about sort of how there might be different funding streams available for different populations. Likewise, there are different funding streams based off of health outcomes. Specifically, as we talk about value-based care contracting, there's a lot more money tied to A1Cs than there are around transitions of care, but never kind of getting outside of the evidence, as it were. And this gets in a bit related to your farmer relationship and also your philanthropic relationship. But I really would emphasize you think about the neighborhood too, because I think especially as we're thinking about this in terms of test a small change, the best way to think about that test is in a neighborhood. And once you sort of think about this in neighborhood blocks, all of a sudden, I think the partners really kind of, not trying to, I don't know, awful metaphor, but boil the ocean, really trying to think about this at a neighborhood by level perspective. Next slide. After you've done all that fun stuff, and again, we're here, I think a really great resource of this grant is I like doing this. You give me a virtual coffee, I would love to kind of sit down and map this stuff out. Again, I'd pay to do this. This is the fun stuff. Then I want you to really think about the different funding streams. Shelby did this way better than I could have ever done this. So this is kind of a Cliff Notes version of what Shelby more eloquently presented. But the kind of 2 different buckets I want you to think about in your squishiness of how you're developing this project. And again, the only way you can learn this is to get to know Shelby, get to know all these amazing philanthropic program officers that exist in our region. But different funding sources will be interested in different elements. So now you got to take off your nerd process improvement hat and put on your car salesman hat and really think about your sales perspectives, because different elements of this project are wildly attractive to different audiences, not only related to funders in terms of film or in terms of small dollar givings, but your foundations. So you have foundations, amazing foundations here in Cleveland that are really interested in specific populations. You have, so Bruning Foundation is an example where they are really laser focused in on kids. They want to do programs related to kids. As Shelby mentioned, you have foundations that are really interested in specific neighborhoods. And not a foundation, but you have specific funding sources that are really interested in particular health outcomes, like lead poisoning. So if you were to go to Bruning and talk about a neighborhood that you want to address, Janine's wonderful. Janine Gurgel will say this isn't an alignment. But if you come to her with a sales pitch related to a young early childhood, all of a sudden you're cooking with oil and you can start the conversation. And again, good program officers like Shelby will be able to pivot you and help you develop your pitch. But recognizing there's an old community organizing principle I love is people do things for their reasons, not for your reasons. So the key step in you mapping out your process is to understand all the different reasons that exist in your project. So you may think of it as a way to sort of improve A1C outcomes, but it's also a way to engage with farmers. It's also a way to sort of improve patient retention. It's also a way to improve reimbursements. Like all these different elements, all of them are true, and none of them are better or worse than the other. But and again, this is where I think doing this in community is critical, because you might be feeling a little stressed right now. This all isn't you, but it's in a team of you working together. And then, as Shelby mentioned, we have some tremendous corporate foundations that really like to work in this space. Vitamex is just out in this area, and they really like working with food. So I think that's an element. And the only way you're going to get to know them is by buying coffee and buying a beer and making friends, as it were. And at the end of the day, you got more friends. So what more could you ask for in life? So again, I think there's a process as a part of this. And again, I think there's a perspective that I think Kim really provided related to the farmer. And it's much better from an economies of scale perspective to treat this as a community approach. But from the clinical approach, perhaps the best way to get this moving is in this test a small change. Because I think even with this test a small change, you can start to really push ultimately what's going to move the needle in long-term system investment is the dreaded 3 letters of ROI, that your executive and C-suite level are going to want to see the return on investment of this, and really want to be able to see that, with this investment, were we able to see the subsequent improvement of preterm birth, patient retention, whatever it may be. So really kind of engaging in that process. Next slide. So we also have a lot of really great national partners. I'll rely on Kim a little bit to talk a bit more about this, but there are a never-ending set of resources that are available, and really becoming aware of what's available, when it's available. We mentioned the Elevance Health Foundation, Walmart, again, lots of different opportunities. And this is where the squishiness comes in. So opportunities might come from the American Cancer Society. They might come from the American Pediatric, they might come all these different elements, and kind of thinking about what is your non-negotiable of what you really want to do. So maybe you really want to do something with kids, and keeping an eye on these different funding sources. Maybe you're really laser focused on a health outcome. So you really want to do diabetes, but whatever your non-negotiable is, the negotiable aspects of really opens up the door of potential funding opportunities. Next slide. So that's sort of the broad scope of things. And again, we are here if you are interested in participating in this with technical assistance. And along that same vein, we want to open this up for questions. And again, I want to emphasize that we may not have the answers, but we can at least respond to your question as best as we can. Because again, this is a very complex multi-stakeholder process, but you have resources here to kind of guide you along in these next initial steps. But thank you very much for your time.
Hey, thank you, Chris and Kim and Shelby and Leora. Yeah, if anyone has questions, you can raise your hand, add it in the chat, or put it in the Q&A box. I do have a couple questions for Leora. Yeah, I was just thinking about like the program that you participated in. Was there like what advice would you give to people who are operating or designing a new produce prescription program, like when they're thinking about the experience for the participant in the program? Like any advice that you would share?
I would just say the demographics matter, like the area. You just want to make sure it's accessible, and just really research in the areas, because transportation is really big and it's a huge barrier for many. And I know that when I first started in the program, they were just handing us coupons out every month and we'll go. But the next following year, they started doing like a drawing for some people to get prepared boxes to come in, because which they noticed that some people weren't able to use the coupons because the farmer markets weren't in their area. So that's something big that they need to take in consideration, just making sure it's accessible, maybe.
Thank you.
Any other questions that folks have? Again, please feel free to pop them in the chat and we'll do our best to answer them. But yeah, this has been great.
One other thing that I did also notice with the second round when I first started the program, when the first year, and I go to Cleveland Clinic, Stephanie Tubb Jones location, and it was great. The hiccups that I noticed was the disconnect between the programs and the farmers. So I guess it's different color coding with the coupons. So of course it kind of trickled down to one of the participant. They're like, we're standing there shopping and we're trying to figure out. They didn't know if this coupon was working and that coupon was not working. So just really just communication to be strong between not just the participant but the farmers too would be really helpful.
Yeah, thanks, Laura. I know the farmers markets throughout the state, like the vendors will get lots of different coupons for there's many different, incentive programs or produce prescriptions, and I'm sure that can get confusing for the
Yes,
vendors.
very, very.
Yeah.
But all in all, the good outweigh the cons. So
Yeah. Did the program that you participated in, were there opportunities throughout the time that you were in the program to give feedback, and like were they adapting in real time and changing things?
yes, they were so out because I very vocal and I was like trying to help the farmers because you don't want them getting stuck with coupons that they can't cash in. But so I kind of took it on the responsibility of getting back and trying to, feedback. And they also gifted me a nice Whole Foods gift card because they liked the support. They did not know a lot of things that were going on, and I was giving them feedback in real time, so they were appreciative of that. So hopefully this year coming, we'll see some better improvements, and it's been getting better and better each year.
That's great. Hey, I don't see any other questions in the chat or the Q&A. But if you think of something, feel free to put it in there. We've got a few minutes left. Okay, so we're going to move on to what's next. So as Chris and Kim mentioned, we do have the opportunity for folks to sign up for a technical assistance session. And we're hoping to complete all of these before September, so sometime in the next few weeks. So if you're interested, I'll put this link in the chat, and I'm also going to email the slides and all of the links that we've shared today to everybody who signed up or attended today. So this TA session is really just one-on-one time with either Chris or Kim to talk with them if you currently have a produce prescription program or you're thinking of starting a new one, or if you just want to like learn more and brainstorm. They can help you with program design, strategic planning, preparing to apply for funding, finding funding sources, really just, getting you from that space of, either expanding your program or going from the idea and the plan you have to actually being able to implement it with the funding and support that you need. So they can help you with that plan and give you feedback on the plan that you have. So yeah, I'll put that link in there, and share that with everybody so you can sign up for a TA session. And then we also have the Produce Prescription Working Group is another activity within our REACH project. And that group is very focused on policy and at the local level. So within Cuyahoga County, we've been started meeting in June of 2024, so a little over a year now. The first year was really getting to know each other within the group, meeting with folks from around the state and other states to learn about what they're doing related to produce prescriptions and learn about policy opportunities to expand produce prescription programs. So if you're interested in joining that group, it is pretty open. So feel free to email us at reach@case.edu if you're interested. Our next meeting is next Friday, August 15th from 9 to 11 in the morning. We usually meet every 2 months. So yeah, if you're interested, contact us for more info on that. And then if you're interested in staying connected with what we're doing in the REACH project, you can sign up for our newsletter, which comes out every couple months. And then HIP Cuyahoga, which is part of the Cuyahoga County Board of Health, they've been posting all the updates about the REACH project and fruit and vegetable incentive programs and produce prescriptions. So they'll be sharing updates there as well. And of course, you can always connect with us via email too. Okay. All right. Thanks, Shelby, for sharing all those links in the chat too, for all the foundations. We'll make sure to add those to the notes that we share out with everybody. Okay, Chris, Kim, Shelby, Leora, do you all have any final thoughts before we wrap up?
No.
I just think it's incredible what you all are doing in the Cleveland area by standing up multiple programs at one time. I think the potential impact is it's hard to describe, right?
Mhm.
Especially once those groups start collaborating even more intentionally with each other. Oh.
Okay. Awesome. Well, if you all think of any questions after we end the call, feel free to email us at reach@case.edu. We will be posting this recording on our YouTube channel as well. So if you know anyone that wasn't able to attend or they might be interested in learning more, feel free to, we'll be sharing that link out later this week as soon as it's posted, along with the slides and contact information for all our panelists. So thank you all so much. And thank you, Kim and Chris and Shelby and Leora, for your time today.
Thank you. Bye.
Okay, have a good one. Take care.
Too.